Hey guys, Dr. Justin Marchegiani here. Today we're going to be talking about Hashimoto thyroiditis, autoimmune thyroid issue, and low iron. Can low iron be a factor with optimal thyroid health? Yes, we're going to dive into that topic here today. Before we do, please smash the like button, make sure you sub and hit the bell. Love to get notifications of new videos coming your way for you guys. Also, put your comments down below. Love to see what you guys have to think as well, and we'll be responding to those. So first off, out of the gate, iron is very crucial for helping to synthesize and make thyroid hormones. Again, guys don't have to worry about it as much because they're not menstruating every month. Cycling women are going to be menstruating for 3 to 7 days. They're going to be losing blood. There's a chance that they have estrogen dominance and or low progesterone. They could be excessively menstruating, causing low iron. Women who are menopausal, they no longer have that menstruation flow. So if that's an issue, that variable is now crossed off. Now, it's possible there could be vegan vegetarian diet where there's just not enough high quality animal heme-based iron that's better absorbed and that actually increases your stored iron called ferritin. So if you're vegan or vegetarian, that could interact with cycling women, menopausal women, and even guys. And also if it's chronic gut issues where you're not really breaking down your proteins and your fats, you're not making enough hydrochloric acid to ionize your minerals, especially iron and ferritin, or iron and converting it to ferritin, which is your stored iron, that could be a problem too. And if we have chronic gut inflammation from gut bugs, infections, diarrhea, chronic gut inflammation, right? Maybe we have elevations of calprotectin or eosinophilic protein on our blood test or stool test. That could tell us that maybe there's some malabsorption there too. So that's possible as well. So when we deal with thyroid issues, we don't just look at the thyroid, we look at the entire system and we look at all the nutrients that need to come in, get absorbed and assimilated to help make and run these different thyroid pathways. Well, let's dive in here off the bat here. So first off, good article, multiple nutritional factors and the risk of Hashimoto's thyroiditis. So really good article here out of the gate. So a couple of things I want to highlight. Chronic exposure to excess iodine intake induces autoimmune thyroid issues. So really important here out of the gate. You got to be careful of the excess iodine, especially over 500 micrograms to 1 milligram. That could potentially drive autoimmune thyroid issue. Be very careful of that. Also, selenoproteins are essential to thyroid action. They're going to help make glutathione peroxidase. Glutathione is going to help modulate your T regulatory cells. It's going to also help decrease excessive hydrogen peroxide. When you go to make your thyroid hormone, there's a process called iodination, where you have these sodium iodine symporters that help bring iodine into the cell. That iodine, then you have this deiodinase enzyme that helps fuse the iodine with the tyrosine, and you have T4, which is your T4 is your inactive thyroid hormone. That is basically 4 molecules of iodine and a tyrosine amino acid, and you have this thyro binding protein, which is going to basically be tyrosine based. And so you have these 4 molecules of iodine. The enzymes that help bind that are going to be selenium based, and iron plays a big role as well. So a couple things here out of the gate. You're going to see genetic data implicates the anti-inflammatory selenoprotein. So selenium is very anti-inflammatory. It's also going to talk about here that selenium proteins can reduce thyroid peroxidase. So it's decreasing your thyroid antibodies here. Iron deficiency impairs thyroid metabolism right here. The TPO, the enzyme responsible for the production of thyroid hormone, is a heme iron-containing enzyme. An enzyme which becomes active at the surface of that thyroid tissue, and that Hashimoto's thyroid patients are frequently iron deficient, since autoimmune thyroid gastritis, which impairs iron absorption, is a common comorbidity. So you can have a lot of gut issues as well that can decrease the stomach acid and impact the absorption. Treatment of anemic women with impaired thyroid function with iron improves thyroid hormone concentrations, while thyroxine and iron together are more effective in improving iron status. Lower vitamin D status has been found in Hashimoto thyroid patients as well. Why? Because vitamin D plays a major role modulating the immune system. It's going to help modulate T regulatory cells. Up above, when we talked about selenium right here, that impacts the glutathione peroxidase enzyme. And that's going to help modulate the immune system too. So very important out of the gate. So vitamin D. And then, however, other data and the lack of trial evidence suggests that low vitamin D status is more likely the result of autoimmune process that includes vitamin D receptor dysfunction. So really important here out of the gate. Clinicians should check patients' iron levels, especially in menstruating women, so if you're cycling age, and vitamin D status to correct deficiencies. Adequate selenium intake is vital in the areas of iodine sufficient in iodine deficiency or excess. Right? If you're doing too much iodine and you don't have enough selenium, you're spitting out a whole bunch of hydrogen peroxide that can drive inflammation. So very important that we have enough selenium. If you have overtly low iodine, then you're not going to have enough of that sodium iodine symporter to bring that iodine into your cells and to synthesize the thyroid hormone, bind those 4 molecules of iodine to that tyrosine, thyroglobulin protein to make thyroid hormone. Hope that helps guys out of the gate. And again, this article here was in the journal Thyroid, Multiple Nutritional Factors and the Risk of Hashimoto's Thyroiditis. Hope that helps out of the gate. So when we look at thyroid patients, right, we're looking at not just iron, but how do you even pick up iron, right? We didn't even talk about the diagnosis. So most of your conventional docs are going to run a CBC, which will contain your red blood cells, your hemoglobin, your hematocrit. It may also look at like your indices, like MCH, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, mean corpuscular volume. If those goes low, that tends to mean lower iron. If they go very high, the top 10, 20% of the range, that can mean lower B vitamins, B12, folate, potentially B6. Now with the CBC, red blood cells below 4.2 starts to say maybe there's some low iron. Maybe hematocrit below that, in that lower part of the range. Off the top, I want to say maybe 33 through 35. And then we have hemoglobin, right, below 13. So these are good markers. Now, again, you may not be flagged though, right? Your conventional MD may say, well, if it's not red, it's fine. But we got to look at it and say, well, 95% of the population fits in the normal range. But we know going to an airport, 95% of the population isn't healthy, right? So we want to have an optimal range, not a disease range. Your MD's working with a disease range. We want more of a functional optimal range. And so those numbers I gave you will help pick up more subtleties. Now, we can also run a ferritin. Ferritin is more of your stored iron, right? So think of iron serum. Think of iron serum as like money in your wallet, right? It's what's in your wallet that you have accessibility to right now. Think of ferritin as like money in the bank, right? Well, all your money that's in your bank may not be in your wallet, right? So it's just a good analogy. So ferritin gives you the stored iron, where more of the iron serum is what's in your wallet, what's in your purse, what's accessible right now. And so running ferritin is helpful. Looking at iron saturation, we want that 25 or up. Ferritin, I want 30 to 40 or up is good, especially if you're a female. We want to make sure there's enough there. And then if you're testing, test within that week or so after your period, after your menstruation. Because if you feel really depleted and tired, it's possible you could have just really depleted your iron. It may take you a week or two to come back, and then you're ready to start the process all over again. So you're living this vicious cycle. And you really have to get to the underlying issue of estrogen dominance, low progesterone. Maybe we're having hormone detoxification problems. That same glutathione peroxidase enzyme that's important for selenium and autoimmune inflammation, well, that may also help with detoxification of hormones too. So you see how everything's kind of connected here, right? And then, of course, they talked about the autoimmune gastritis issue. The gastritis plays a big role because all the nutrients that run these systems, they all have to get absorbed through your gut. They go into your bloodstream, they get utilized, absorbed, and assimilated. So we have to look at everything holistically. So iron does play a role. Animal-based iron will be the best. If you're just saying, well, look at my spinach, it's got a lot of iron on there, that does not move the needle when it comes to ferritin that much. It will not move that needle. If not, you would never see vegans or vegetarians that are eating green vegetables get anemic, but you do all the time because there's heme-based iron and non-heme-based iron. Okay, heme-based iron is going to be your animal meat, your animal protein, and your non-heme-based iron will be like your spinach. Yeah, it says high in iron in there, but how much are you absorbing? How much it's actually impacting your ferritin and bringing up your hemoglobin? Not that much. So you need to really work on the animal products. And also, if you have gut issues, you need to also be able to ionize your minerals. So ionizing essentially is acidity breaks that mineral down so it can be absorbed in the bloodstream and can flow around and be moved and transported. If we don't ionize it, if we don't use that acidity, break it down and make it movable, then we can't transport it and use it in our body. So we need good hydrochloric acid to be able to create that ionization, activate the proteolytic enzyme so we can break down, absorb, and utilize. All right, so just to kind of recap here, iron plays a very important role. The enzymes that iron activates helps make thyroid hormone, and also the T4 and T3 also require selenium too. And if you're having problems absorbing iron, you may also have issues with selenium too. But if you're a female, you have to fix the hormonal imbalances that are driving the bleeding problems. If you have gut issues, you have to also fix that. It's not as simple as just taking iron. And then also, if you have a vegan vegetarian diet, you have to change that. And if you're having a hard time eating meat, you probably have low stomach acid and enzymes. Now, that being said, products that I use, I have a product called Iron Supreme, which is an iron Glycinate, which is very well absorbed. A lot of the conventional medical doctors are going to use like a ferrous sulfate, turns your stool really dark, not as well absorbed. So I like the iron bisglycinate, my iron supreme. We'll put the link down below. And also, if you're really sensitive, we may also even add in like an iron in liver glandular, because iron's very high in liver glandular tissue. So we may use grass-fed, pasture-fed kind of beef, for instance. That's going to have extra vitamin A. It'll have some B12 in there, and it'll have some extra iron. We may do 3 to 6 capsules or tablets a day of a good quality liver beef that's pasture-fed, grass-fed. So we can choose kind of both those options. If we have to go fast or something, we may want to use an iron chelate like a bisglycinate to bring that ferritin level up faster. All right, guys, hope you enjoyed. If you want to dive in deeper, you need more support, there'll be links down below to reach out to my staff and team if you want to dive in and get functional medicine support worldwide. That link will be there for you guys. All right, feel free and share with families and friends if you enjoyed it. Take care, guys. Have a good one. Bye.